With the overcrowding or long waits in the emergency departments, here to tell us which one to choose, ER versus urgent care, is our own nurse, Christina. Good morning.
Hi, good morning.
Good morning to you. So this is so interesting. So why is it such a big deal to use the ER or urgent care?
So there's over 130 million ER visits annually. So there's a lot of people that come in. A lot of the reasons that people choose the ER is the 24-hour availability. Sometimes they lack insurance, and so you can go there, and oftentimes that's covered, or there's some kind of compensation for that. Lack of established primary care providers, they just aren't established with somebody in the community. Limited access to primary care, and just trust in the comprehensive knowledge that ER providers have. But the problem of that is, like you said, it can cause overcrowding, long waits, excessive costs, and you know, the average emergency department cost is $767. So yeah, that's a lot, versus an office visit, which is around $187. So
more affordable.
Big difference. Right, yeah.
Oh.
And so how does one know which one to use, ER versus urgent care?
That's a good question. And I know I was actually kind of surprised by this too when I was reading and then talking to some friends who work in the urgent care. So when you're looking at emergency room, we're thinking about life over limb. So like an acute illness, something that has to be dealt with like right away, life-threatening illness. So things like choking, if you stop breathing, head injuries, if you get shocked, you know, electric shock, severe burns, chest pain, trouble breathing if you've passed out, if you have pain in your arm and jaw, dizziness, deep wounds, serious burns, if you're coughing up blood, severe pain anywhere, high fevers, and things like that that aren't getting better with medication. Oof. Yeah, that's when you go to an ER. Okay. Now sorry, I should have clarified in the beginning.
Okay.
So an urgent care is when something's medically necessary. So maybe you can't get to the doctor right away. Maybe there just aren't appointments. So falls, injuries, if you break a bone, fever, eye injuries, rashes, sore throats, sprains, things like that, you can go to the urgent care for. I was surprised by broken bones. I always thought you had to go to an ER, but that's not true.
I've gone for ear infections too. So
and that's right, absolutely, because you know, it might take a few days or a week sometimes to get into your primary care provider. So it is good to go in and you can be seen faster that way.
Wow, that's really crazy. So should someone go to the ER or urgent care if they are COVID positive?
So COVID positive, you can go to the ER, but you want to make sure that they know about it in advance. So call. Don't show up. We don't want patients in primary care. Again, this is viral. There's nothing we can do in a primary care clinic for COVID right now. So there's no medications we can give you. So if you're having severe life-threatening, you're having the shortness of breath or the chest pain, and you're around somebody in your household is positive for COVID, you can go to the ER or the urgent care to be evaluated. We don't want you in primary care for that. But if you do have any questions, always call your primary care provider. And it's always a good idea to have one established. Know where you're going to go, know where the nearest ER is, know where the nearest urgent care is, and establish yourself with a primary care provider. You know, we're good about it when we're real little, but even at your age, you should go in for annual physicals. It's really important that you find somebody that you can establish yourself with, that they're familiar with you.
Right. No, that's really true. I need to go get a physical myself right now. So I completely get that.
Yeah, you want to do
that. Thank you for all the tips and tricks and to know the differences between both of them. It's been super helpful.
Yep.
Well,